So we've got a nice all island variety of locations, which is lovely and reflects the organisation quite well. So you're all very welcome this morning to this webinar. Thank you for taking time out of your busy schedules. It's not always easy on a Monday morning to make time for these types of things, but we're delighted that you're joining us. Just a few bits of housekeeping before we get started. So this event is actually taking place as part of the National PPI Ignite Festival. So many of you will know that there's PPI events happening all across Ireland for the month of October. So I would encourage you, if you like what you see this morning and you're interested in PPI, to go have a look at the PPI Ignite website and the calendar of events, because there's lots of fantastic online and in-person events happening throughout the month. And there really is something for everyone there. So I'd encourage you to have a look. Before we get started, just to say that this webinar is being recorded. So we'll record the presentation and the panel discussion. We will stop the recording before the Q&A session, but the first part of the webinar is recorded. So just to let everyone know that. If you could all keep yourselves on mute, that would be brilliant. And if you could keep your videos off, everyone except the speakers, that would be brilliant as well, because this is being recorded, so it just helps with the recording. You can put questions at any stage, you can put them in the chat, but there will be an opportunity, like I said earlier, there'll be an opportunity before the question and answers to unmute and ask your question as well. So I would encourage you to keep note of your questions as the session goes along. So I think that's all the housekeeping bits that we have. We're going to get started now. Jane, if you're ready. So Jane Clare is going to introduce the PPI impact framework that we're going to talk about today. Many of you will know Jane. Jane joined the All Ireland Institute for Hospice and Palliative Care in October 2023. She's the project manager for the Palliative Care Research Network and the Early Career Research Forum. And Jane comes to the Institute with a background in social research, so both in managing research and in conducting it herself. She's an experienced researcher and has many years' experience working in the disability and healthcare sectors using the rights-based and person-centred approaches. So I'll hand over to you, Jane, if that's okay.
Wonderful. Thank you so much, Emmy. Thank you everyone for joining us this morning. We're delighted to have so many of you here. I'm going to very quickly run through a little bit about the All Ireland Institute Hospice and Palliative Care. I'm aware that there were some new names on the registration list, so we're delighted to have you all this morning. Now, just to run you briefly through the All Ireland Institute of Hospice and Palliative Care, left our mission statement there. AIIHPC's aim is to ensure excellent palliative care is available for everyone, the right time and place across the island of Ireland. So essentially, the Institute is a collaboration of 26 member organisations, and we work across all of these organisations, and we work across research, policy, engagement and education. So that's a little bit about the Institute. Palliative care itself, I just wanted to say a few words about palliative care. I think it's really important to give this as a context for the rest of the webinar. Palliative care itself is a specialised approach within healthcare. It sometimes carries negative connotations with it. People tend to associate it with death and dying, or perhaps end of life, which may be, I suppose, the general individual's experience with palliative care. And I just wanted to highlight that it carries its own philosophy, and is very much broader than people really think about palliative care. So it's just to leave the definition up there and to give it a little bit of context for this morning. Just to talk very briefly about the research team in the All Ireland Institute of Hospice and Palliative Care. We have two research networks, the first of which is the Palliative Care Research Network, which is 66 leading researchers across the island of Ireland, across our member organisations. These are academics that generally focus solely on palliative care, and they tend to be mid to senior in their career trajectory. The big event that we have annually for the Palliative Care Research Network is the PCRN Symposium. And this year it's being held in the Woodkey venue in Dublin. Last year we had it in Stormont. And it very much is an opportunity to get all of our researchers together to talk about research and all things palliative care. In addition to this, we have the Early Career Researcher Forum. This may be of interest for some of you participating today who might potentially be new to the palliative care space, but maybe thinking about it. We have 300 members of the ECRF on the island of Ireland. The only requirement to join the ECRF is that you have an interest in palliative care research and that you are on the island as such. My colleague Bushra is going to put in links at the end of my presentation around Early Career Researcher Forum. The Early Career Researcher Forum offers a number of opportunities to researchers. We run webinar series, we run blogs, podcasts, we have events. Another element of the institute that we run is also our Voices for Care PPI group. Voices for Care is a group of 65 people, representatives on the island of Ireland, who are sort of our pool of PPI contributors. So say, for an example, an ECRF member had a research project that was coming up that they wanted to get a PPI contributor involved in. They could send it to us and we could circulate it to the Voices for Care group on their behalf. So I mentioned there are a number of different things that we offer the ECRF and different researchers. And the thing that I'm going to talk about now is the PPI Impact Evaluation Framework for Palliative and Healthcare Research. And I suppose just to talk a little bit about where this came out of. As an organisation, we are aware that, tracking PPI impact is very, very difficult. It can take a number of different forms. It can be very nuanced. You could take something like conversation at the start of a research project around how a title is worded, and it could impact the whole entire research project. There became, and we have been aware that, PPI impact is happening, but we wanted to dig a little deeper and we wanted to think about how it was happening. What does it look like? Is it the same for all research projects? Is it the same across the research cycle? Where is best practice happening? And where could we highlight perhaps improvements? So we started work on the impact evaluation framework for PPI. As part of this, we were very lucky to have Padraig Cronin, who'll be part of the panel later this morning, as our PPI Ignite Summer Scholar. It was a two-stage process. So Padraig undertook the first stage of this, and it was to create a draft PPI impact evaluation framework. So this took the form of an extensive literature review to look at different types of frameworks. What did they look like? What were they measuring? What were the outcomes? Following this, he undertook two focus groups, one with our Voices for Care group and one with researchers, and was able to take all of this masses of information and put together a draft framework for us at the end of last summer, which was, quite a mammoth piece of work, and we ended up with quite a large draft. So after, I suppose, what I would call quite a rigorous editing process of all of this information to refine it down basically to a framework that was usable. We took a lot of time in the editing of the framework because there was so much information and it was so wonderful, but all of that is it has to be able to be implemented and people have to be able to use it and people have to be able to fill it out. So we ended up with what is our current framework. These are some of the different things that we wanted to look at. We were conscious of research outputs across the research cycle. We're really conscious that partnerships and collaborations are established in a research project, and we wanted us to measure that, or just to put some sort of shape on it. And you know, I suppose with the framework, we want researchers to fill it out. What we're hoping to do is build a picture of PPI impact. So it won't be one that comes back or two that comes back. We're hoping over the course of, say, for example, 3 to 5 years, if everybody sends us back a PPI impact evaluation framework filled out, we're going to be able to put them together. And we're going to be able to build a detailed picture of how PPI impacts research, and to try and chart the difference that it makes. The PPI impact evaluation form is the first section of it, and this is to be completed by the researchers in collaboration with the PPI contributors, so everyone's in agreement with what's being said. There's also PPI contributor feedback form. So this is taken by the PPI contributor to document their experience, and then that's done independently. We've also included a reporting checklist. So this was an attempt to sketch out the different research stages, and to help the researchers say, well, have I done this, and have I done that, and have I done, and are we heading in the right, direction? My colleague Bushra is going to put up a link in the chat to the impact evaluation framework. Just a few last points that I want to say about it, that it's intended to be used across the research cycle. But if you have already started your research, you can pick up the framework at any time and fill it out. So you don't have to have it at the start. That would be great, but not everyone is that organized, and life doesn't necessarily happen like that. So if you are engaged in a piece of research and you're slightly curious about how things are going, please feel free to start it. Fill out what you can. The first section everybody has to fill out, but further in the details, there's different sections. So say, for example, you didn't have a media campaign, or you didn't engage in sort of media promotion about your research, that's fine. You please feel free to leave that blank if it doesn't apply to you. It isn't a test. We're not going to come back and say, well, you should have done that. We're really, as I said, hoping to look at all of them together to get an impression of what's working well. And I will say that it's designed really as an empowerment piece, that we're able to show our researchers that this is the impact. When we talk about meaningful collaboration, this is how your research is better because of PPI contributions. Conversely, we're also really want to show our PPI contributors you are having an impact, and this is how. Sometimes the PPI contributors will say to us, well, I'm not sure, I can't see where I'm making the change. And as I said to one of the panelists earlier on, very often it could be a conversation with a PPI contributor that could change the whole outlook of a research project. So it is really just to get a sense of how things are happening. I'm going to hand back to you, Emmy, and I'm going to stop the slide share. Bushra, if you wouldn't mind putting the links into everybody. The last thing I'd like to say about it is that it is designed for palliative care. It's designed with it in mind. But if you're a researcher who's not working in the area of palliative care and you want to fill it out, or you're curious about it, please fill it out. And also, please send it back to us. We would love to see it. We'd love to read it. We want to know what's happening. And also to think broadly about palliative care. Because a lot of people say to me, I'm doing research and it's not in palliative care, and they say what it's on. And it could be an area of health care that could be considered palliative care. So to think broadly and to think creatively about it, but send it back to us if you do have it filled out.
Super. Thanks very much, Jane. That was an excellent overview of the Institute, but also of the framework itself. It's really helpful to have more information. And thanks, Buster, for putting the links in the chat as well. That's really helpful. And I love what you're saying there, Jane, about not having, that the idea of not having to have everything ready before you fill out these impact frameworks. And it's something that you can do at any stage, no matter what stage of the PPI process you're at, whether it's at the very beginning or whether you're halfway through or maybe you're coming to the end, that you can use this framework almost as a tool or as a resource to help you think a little bit more about impact. So I think that flexibility is really important. And really interesting that you're planning to collate different examples of PPI impact across palliative care research. And you mentioned there kind of painting a picture of PPI over the next 3 to 5 years, because we hear a lot, don't we, about meaningful PPI. But that word meaningful isn't always defined. So something like this can help us understand, okay, what does work well and when does it work well, and what are the key ingredients, I suppose, of meaningful PPI. So I think it's really important, an important step forward for that. So we might move on now to our panel discussion. And our panel discussion really is focused on the framework and the development of the framework, but also on the impact of PPI more broadly. And we've got some great speakers lined up for you all. Firstly, we've got Dr. Mary Nevin. Dr. Mary Nevin is an assistant professor of nursing and a lecturer in the School of Nursing, Psychotherapy and Community Health in DCU. Mary graduated as a registered general nurse in 1999 and a registered nurse tutor in 2005. And she's over 20 years of experience teaching in third level institutions. And as well as her academic role, Mary maintains her clinical skills through her work as a night nurse with the Irish Cancer Society. And she provides end of life care for people and their loved ones in their own homes. So you're very welcome, Mary. We also have Linda Cooper. So Linda is one of 7 sisters who lost their father, Patrick Kelly, in 2022. She trained and worked as a nurse for 40 years within the NHS in Northern Ireland. She's semi-retired. She's a husband and 2 adult children, and of course 2 dogs as well. You'll have to tell us more about them, Linda. Following the loss of her father, she became passionately involved with several organisations in the attempt to improve the provision of palliative care to patients and their families, so that everyone has the same access to best palliative care. We also have Padraig Cronin, who Jane mentioned earlier in regards to developing the framework. So Padraig is a 4th-year graduate entry medical student at University College Cork, having previously graduated with a bachelor's in engineering, in aeronautical engineering, no less, from the University of Limerick in 2021. And his research interests include measuring quality of life factors for patients within palliative care and neurodegeneration, as well as medical device development in surgical and medical applications. And then Jane is going to join us as well for a discussion who I introduced earlier. So you're all very welcome. Super, you've got your cameras on, brilliant. So we might start actually with a question for you, Mary, and Linda as well. I'm curious to see from both sides of the coin, if you like, what are there PPI impacts that really stand out to you? Can you think of examples or situations where you've seen PPI really having a real impact on research?
So this is Linda here. As I said, whenever Dad died in 2022, our family tried to get actively involved in lots of projects. My daddy passed away in Northern Ireland in the Western Trust, which is the McGelvin Trust, and that's where I'm originally from. And some of the issues that we encountered whilst Dad was dying was the availability of medication, trying to have the right medication in the house to support him. And of the 100 hours that Dad was at home before he passed away, 20 of those were spent looking for medication around the local pharmacies. So there was 20 hours of time we didn't spend with Dad. So Western Trust had already got an idea about a thing called they call it just in case pack, which is anticipatory medicine. So I worked with them on that project, and I'm delighted to say that they introduced the trial run of that project in the Derry area to start with, and it's now rolled across a lot of the Derry area. and they're actually now going into a second phase where they're trying to roll it across for patients that aren't just at the end of life, patients that are, in the community that have other conditions, so that they have anticipatory medicine. So from the PPI,
we've lost sound. Is that just on my side?
Lost you, Linda.
We've lost you, Linda, there a little bit. We can't hear you, Linda. Do you want to come in, Mary, while I think it might have Linda's might have frozen there.
Yeah, no problem. Thanks, Emmy. I suppose a little bit about my research background and my experience with PPI. I was PI funded on a couple of projects, and we integrated PPI within the application procedure, and we had very clear and transparent mechanisms about how we were going to integrate PPI in the project. I hadn't used PPI formally within my PhD, which I finished in about 2019, 2020. So I have to say, from my perspective, there was definitely a little bit of anxiety about bringing in PPI formally into a PI-funded project, and my time frame, the amount of commitment that it would need, and how I would manage that within a collaborative project with academics, with other clinicians. And yeah, our project was a 2-year project. We were very lucky to have a person who came in as an expert by experience, and the project involved integrating generalist palliative care within specialist oncology service provision in hospitals. So this person came with a wealth of experience, and we were very lucky to source this person through the All-Ireland Institute, which was really good. The relationship developed over the 18 months, and I would say that it was slow at the beginning, in the sense that while I set the project up as a post-COVID project, so most meetings were online and facilitated via Zoom. It was really important to meet my PPI contributor in person and spend time to understand her motivation for wanting to be on the project, her experience, her background, and how proficient she was in Excel, in Zoom, in computer-based projects, and that, just to make sure that we were meeting each other, and I was providing extra supports and training where needed. Even just setting up meetings, making sure it facilitated her time schedule. She was a busy grandmother, with constraints of the 6 or 7 other contributors as well. But ultimately, while we didn't engage our PPI contributor formally until after the planning, idea, concept phase, our PPI contributor was absolutely integral to the co-producing of our study, of our survey material, of our publication material, of our interview material. And we also integrated a phase of a workshop led by myself and our PPI contributor, which was just fantastic. And it really informed our findings and our dissemination work as well. And we even, she even spoke to our undergraduate, 300 of our undergraduate students here in DCU about her experience of care in hospital, with her loved one, negative and positive. So it was a fantastic learning curve for us. And I think she will agree that it was very much symbiotic. She got plenty out of being involved as well. So I think it was daunting at the beginning, but with some good training, support, and we did have very good support from our funders, the Irish Cancer Society, and the All-Ireland Institute. So it ended up being a really meaningful project, and I wouldn't hesitate to go down that route again. I think it's essential, really.
Super. Thank you. Do we have you back, Linda? You were telling us about the just in case package. Oh, brilliant. Do you want to tell us a little bit more?
Yes, so I worked very closely with the Western Trust in their project to roll out the just in case medicines pack. And they were very, very pleased to say that it actually started out, they actually ran a trial of it, which was very successful. And they're now running a phase 2, which is to introduce the just in case medicine pack for patients that aren't at that late stage of life, that they aren't in the palliative care end of life stage. And they're going to start running that project out, and I'm going to be working with them on that project as well. So from a family perspective, we felt that we'd had an impact already on some families who are dealing with
with that terrible situation with their loved ones at home and the medication wasn't necessarily available. So from a PPI perspective, I feel that we did have an impact, a positive impact on patients, and want to continue to do so.
Fantastic, brilliant. And Jane, I might bring you in there because you have kind of a bird's eye view, I suppose, of a lot of different projects that come into the Voices for Care group and different projects that PPI contributors are involved in. Are there specific examples of impacts that have really spoken to you?
Suppose, there's many, but the ones that are really striking are the ones that are very nuanced or slightly underestimated. One of our senior researchers, when she has a PPI research meeting or she has a meeting with a PPI contributor at it, they go back over their meeting notes or their minutes and they highlight everything that the PPI contributor said in blue. And then as they go through the project, they are actually tracking what the impact of the PPI contributor at the meetings, because that researcher was, in her experience, was finding that it was the softer conversations around how do you word something, how do you look at something from the perspective of the patient. And that was one that was really, really striking to me. Because the PPI contributors were having a sort of an unbeknownst to them, a complete shaping and reworking of the research project, and it was sort of happening over time, very, very subtly. So that would be one impact, as I said, one example, as I said, that was particularly striking. And of course, we can have the examples where PPI contributor comes in and there is perhaps a heated conversation and the research actually takes a better direction or takes a more engaged direction or is a little bit more rooted in the personal experience. So sometimes difficult conversations about maybe the research could be this or it could be that, or have you thought about this or have thought about that? And perhaps that's difficult from the researcher's point of view because they have written they've gotten funding, they've had to write the proposal, they've had to get ethics, there's been a lot of work to get it to a certain stage, and someone will say, well, have you thought about this? And you end up saying, no, I haven't. Just, I suppose, is the point, but can be difficult to manage.
Yeah, I agree. Mary, can I ask, because you mentioned the project earlier and the PPI contributor being involved in all stages over the course of the project, but are there particular stages of the research process that you feel are neglected when it comes to PPI, or that we could see more impact of PPI?
Yeah, that's a good question, Emmy. I think as a researcher, you always have to take a very pragmatic view to involvement of PPI in your research. I think, we have a moral and ethical obligation, not to involve people where it's not meaningful for them to be involved. And I think we have to consider people's time and commitment to projects as well. And then you also have the pragmatic considerations of, the funding, when the funding comes out, the time you have to prepare things, and where is it best utilized. I think if you have a larger project with significant funding and a significant lead-in time, I think you should always be trying to, involve PPI at the very outset and concept idea phase. Obviously, it's informed by the evidence base, but there's that lens that should be there right from the beginning, where it's pragmatic and doable to do that. For one of my research projects, it started after that phase, but there was a huge evidence base about the need to conduct a study as well. But making sure that it is transparent throughout the proposal is important. From our project, definitely, in the the data collection, the data analysis phases, that's where it was hugely impactful for us. I mean, we co-produced a workshop after about half of our quantitative data was in, so we had preliminary findings, and our PPI contributor really led that work with a network of bereaved people across Ireland, and it was just fantastic to have that lens moving into our qualitative phase of the study, so that patient voice was front and center when we were asking the right questions and inform that. I think logistically, there's lots of things to consider, and it was a huge learning curve for me around things like that. That if you know, you may overlook. Just simple things like when we organized the workshop, you know, making sure it was near a car park, making sure it was accessible. You know, some of our people who attended were symptomatic, so making sure it was near the bathroom. You know, I would have potentially missed that without that lens, you know, about organizing things like that. Just making sure that the information is in plain language and circulated to our PPI contributor beforehand. That, you know, I met her beforehand and said, you know, how would you like to speak? Would you like to speak in front of people, and when? We can start with you. Or, you know, so people didn't feel under pressure to contribute. And, you know, just simple logistics like that. Doing a Zoom test 15 minutes before, so she's not stressed or anxious about joining. Really important stuff, and it made for a much more meaningful engagement. So that's just some of our experiences on that project.
Yeah, and I agree, those simple logistic pieces can be absolutely vital in terms of setting the right tone, the right dynamic, and allowing people, facilitating people's voices. So I often say never underestimate the power of a cup of tea at the beginning of a PPI session. You know,
Yeah.
it can be the small things that can make a big difference. So yeah. And can I ask, Linda, from your perspective of a PPI contributor being involved in projects, have you seen examples where the impact of what you're doing can go unnoticed or maybe unrecorded? Are you there, Linda? Are you with us? Wait.
Yeah, sorry, the connection was lost for a short time. So you were asking there to have had an experience of where where PPI involvement maybe not quite heard. Well, at the very start, I suppose, when I was involved in a few different conversations, I often felt in the meetings that I was in that although I was there representing my dad and our family, I didn't know if we were saying the right things, were we having the right kind of impact, and was it just a matter of people were saying, well, look, we have somebody involved here. But I found that over the last few years, and the more and more projects have been involved in the different meetings and things, that they most definitely do reach out to the PPI. For example, for myself, I've actually been asked to speak at various conferences and different things like that, because people feel that what I've got to say is important. And I also feel, again, it's just my own impression, is that I think that whenever the member of the public or the family member speaks at those kind of conventions, I mean, I did get an opportunity to speak at Stormont, and I was actually interviewed on the Stephen Nolan show. And I feel that because there was members of the family speaking out, that our voice was actually sometimes much stronger than the organisations that are behind, because I feel that the people who are sitting in those positions of power are saying, oh gosh, right, okay, this is a person, a family member who's actually been through it, but also they're voters. So I just need to make sure that I'm listening to what they're saying. So I think it's a very, very powerful tool. At the start, I felt it was maybe more of an exercise to say, well, yes, we're involving people, but now it's definitely transformed into, yes, our voices have something important to say.
Fantastic. That's brilliant to see that kind of progression over time. Padraig, I haven't forgotten about you. We might move on to you now, because I'm really keen to hear more about developing the draft impact evaluation framework. So you were a PPI Ignite summer student last year, 2024, and you worked with the Institute on developing the framework, as Jane mentioned. And I suppose I'm interested to know, what were the main things that concerned you in leading this work and leading the focus groups for the project, and how did you overcome these, or how did you handle those concerns? Because as an early career researcher, it's not easy to kind of embed yourself in these types of projects and speak to different people and hear their voices. So I'd love to hear about that process.
Yeah, certainly. I mean, yeah, no, it's a really good question, actually, particularly being, I suppose, for full transparency, this was my first PPI related project that I'd ever actually done before. And it's something that doesn't really come up a huge amount in kind of undergraduate research currently, which is something hopefully will change in the next few years. So I kind of went into it completely open to what was coming down. And of course, I had great mentorship from yourself, from Jane, from Mary, and from everyone on the committee, and on the team rather. And I think, I suppose, going into it, the more I began to read a bit more about what kind of the heart of PPI was, I started to come to mind. I actually got a bit more nervous, to be honest, before the focus groups, because I think one of the biggest challenges for, at least from a researcher's point of view, early career at this point, and maybe you can concur, is making, or rather helping the people feel heard. You know, the contributors feeling that what they're coming to the meeting with, that their story is special ultimately, and it has meaning, it has impact. And I think everyone probably has an example of a project where they might not have felt heard. And some of the questions you just spoke about there really touched on that. So before the focus groups, you know, we were developing the structure out and maybe some of the questions that people might be able to speak about, really doing self-reflection on how, if that was my mother or my father or my sister or my brother in the meeting, how would you like them to be addressed, and how, you know, giving people the time to explore their thoughts and really draw meaning out of it. And I think that's what makes PPI so special, is research can often be very theoretical, and it gets published and it goes on a shelf and it doesn't really change anything. But when you take people's voices, and particularly as something as emotive as palliative care, which I don't think anyone on the call here will ever be able to truly escape at some point in their lives, it's really taking those meanings and being able to translate it out. So I think, yeah, for me, the biggest challenge originally was making, or wanting the person to feel heard in their story. You know, and then the other part, I suppose, is managing the emotional side of that too. And this was something that came up quite a bit from not even just the contributors, but the researchers. You know, I suppose when you're talking about palliative care, and it's a sort of transitionary kind of field where people come and they go for various reasons. Being able to manage people's emotions in that as well. And I don't mean manage in kind of a paternal way, but I mean making people feel that that was important to them and that was special. And yeah, so I think that was the biggest challenge for me as an early career researcher, at least currently speaking. But that's not to undersell how difficult it is. It's very doable, and I think with a really good team. And to be honest, the contributors are the ones who lead the way on that they'll bring you along in the meetings. That if you bring them to the project and you give people a structure to work within, and you give them a very defined question, as Linda was saying, you can really make meaningful research and impact out of that. Absolutely. So that was my experience of the study, if that makes sense, Emmy.
Absolutely. And I think the fact that those were your two main concerns, Padraig, speaks a lot to the approach you took in the research, the fact that, you know, that empathy that is needed for this PPI work. And I think the fact that, you know, one of your concerns was hearing what people are saying. I think it going into PPI with that concern is really important. Actually, you'd be worried if you didn't have that concern. So I think, Linda, do you want to come in there?
Oh, sorry, I didn't want to interrupt you, Emmy.
Not at all. No.
I just wanted to follow up on what Padraig was saying there, that, you know, involving PPI in the actual research project, I feel then that you're able to make that research mean something in the real world. As you said there, Padraig, you know, you don't want it to sit on a shelf and say, we've done all this great work, but we actually haven't applied it in real life. And having the PPI involvement in it, you know, you're able to say, well, what do we feel we need out there in the community? For example, better access to pharmacies, you know, just in case packs in the home, you know, maybe deliveries or financial support or something like that. So we can help by putting our voices forward to help to create that research in such a way that it has a real life impact when it is actually delivered.
Fantastic. Thanks, Linda. And Padraig, what were the key takeaways? So when the work was done and the framework was then being developed, what are your key takeaways from the process and from the framework?
I just muted myself, unfortunately. Yeah, I think there was a number of big takeaways. The big one I would say is the PPI is really crucial, to be honest, to research, and it was something I hadn't thought about a huge amount before the study. And talk about the framework, after the study, I went and took the draft framework we developed, and I looked back at some of my own research from before, and I would have given out to myself, to be quite honest with you, for the lack of PPI in my previous pursuits. So I think the big takeaway was, one, it should be very much embedded in all research going forward, especially, as Linda was just saying, to actually make it applied. And the best way to make it applied is to bring people who are ultimately going to be the ones to see this, you know. Like I say, as a medical student myself, you know, I've been on placements in the hospice, and as a son, having been in the hospice and walking the halls, you know, it can be very it'd be a very different experience for people being on the other side of it. So I think PPI is very critical from that point of view. And the other thing, I suppose, the big takeaway is it's probably a lot easier than I would have originally thought to actually implement PPI. When I was doing a bit more of the literature review at the time, there was a lot of talk about, we spoke about it earlier in this call, implementing it at the right time. So getting it in particularly early in the process is crucially important. But also that, you know, as I said, if you develop a structure with which people can contribute around, so giving someone a very defined question and exploring outwards from that one, it's a lot more straightforward than I would have originally thought. I was kind of worried that, you know, trying to bring people into a point of discussion and then lead down different pathways. But even on this call, you know, we've seen that we've gone off in so many different directions that have been incredibly fruitful. So I would say the big takeaway from PPI really is, one, it's critical. And if there's anyone on the call who is an early career researcher, or even if you're more advanced in your career and haven't done PPI, I would really encourage you to implement it if you can, even just in small things. And the other thing is the contributors will bring the rest of the way for you if you just give them the platform. So it's a lot easier than people would think, to be honest, in my opinion.
Fantastic.
Can
Yeah.
I say something, Emmy?
Absolutely, yeah.
Yeah. So part of the conversation earlier talked about, you know, the ethical responsibilities there is in research. In other words, don't be involving people where they don't need to be. But I think maybe sometimes researchers have a wee bit of an anxiety about involving the PPI, you know, the person or the family, because they think these people are now in a grieving process. I don't want to be impacting that, you know, annoying them whenever they're in that process. From our family's perspective, we were very, very happy to be involved at the earliest possible stage. I think if you reach out to people and they can see that they're going to maybe have an impact or a benefit, then they're very happy to give what they can. And if they can't, or if they don't want to, they'll very clearly tell you, no, this is not the right time for me. So, you know, don't let anxiety stop you from involving the public in your research, because I guarantee anybody who's been through that experience will want to see if they can make it better for the next person coming down the line.
Lovely. Thank you, Linda. That's lovely. And Jane, Mary, before we move on to our question and answer, is there anything that you want to touch on that's been said previously, or any new points you want to mention?
I suppose, and I'd love to hear Mary's thoughts on this. You know, communication is a crucial point, as Linda said, and as you mentioned, you have a bit of a bird's eye view here, so we can hear feedback from the PPI contributors saying, well, we'd like to be contacted more. And we can hear feedback from the researchers saying, well, we don't want to overburden people. You know, and I think communication around that is really key to find a balance and to find what works. But as I said, I'd love to hear what Mary would have to say from your experience, Mary.
Yeah, I agree, Jane, and Linda, you've touched on it as well, and Padraig. I think that we have a moral and ethical obligation not to burden people, but we have to consider that in research there is that paternalistic attitude that you shouldn't really involve people who are grieving or who are going through a tough time or who are at end of life. It's, you know, but we also know the evidence tells us people absolutely want to be included in research and have a voice and want to speak. So I think, absolutely, I agree. Some of it comes from our own fears and concerns. And for me, as a clinician in palliative care for many years, I still had fears and concerns as a researcher and how I was going to bring this into my research. But I think being open, flexible, honest, and not overstating the impact, I think that is important. I think we have to be realistic and honest with people and how they're going to contribute and how they're going to inform it, and how the relationship will develop and materialize, but without overstating as well. But I mean, for example, from my project, you know, our PPI contributor, you know, she was integral to the design and the how the project developed and how the data was collected. And even now, I mean, my motivation was always to conduct impactful research, you know, and I see now disseminating these results with this PPI person by my side. The message is the same, but being delivered by her is more impactful, and it was more meaningful for me as well. As being the PI in the research, the lens was always there, you know, making sure that, you know, we had that voice throughout.
Fantastic. Lovely.